Hey everyone! Welcome back to Zen Zone Health. Today we're diving into a serious topic, the importance of early cancer detection in women. We're going to be talking about 12 alarming cancer signs that are often ignored. Early detection is key to increasing the chances of successful cancer treatment. If something feels off, don't ignore it. I'll break down each of these 12 signs, explaining what to look out for and what you should do if you notice these changes. Remember, knowledge is power, and understanding the early warning signs of cancer can truly be life-saving. So let's get right into it.
Alright, let's start with our first sign: unexplained weight loss. While some weight fluctuation is normal, a sudden and significant drop in weight without any effort is a major red flag. We're talking about losing 10 pounds or more in a short period, like a few weeks or months. This kind of rapid weight loss can be a sign of various cancers, especially those affecting the digestive system, like stomach, pancreatic, or esophageal cancers. These cancers can interfere with your body's ability to process food and absorb nutrients, leading to weight loss. There are many other reasons why you might be losing weight, such as stress, thyroid issues, or certain medications. But it's essential to get checked out by your doctor to determine the underlying cause and rule out any serious conditions like cancer. Early detection is crucial. Moving on to our next sign: persistent fatigue. We all feel tired from time to time, but extreme fatigue that lingers and makes it difficult to get through your daily routine is concerning. This type of fatigue can be a sign of several cancers, including leukemia and colon cancer. In leukemia, cancer cells crowd out healthy blood cells, leading to anemia, a major contributor to fatigue. Similarly, colon cancer can cause fatigue due to blood loss or the body's increased energy demands. Fatigue is a common symptom with many possible causes, like stress, lack of sleep, or poor diet. However, if your fatigue is persistent and doesn't improve with rest, see your doctor right away.
Now, let's talk about a sign that's often overlooked: changes in the skin. Your skin is the largest organ in your body, and it's constantly renewing itself. But sometimes, these changes can be a warning sign of something more serious, like skin cancer. Keep an eye out for any unusual moles, sores, or growths on your skin. Look for changes in the size, shape, or color of existing moles. Pay attention to any new moles that appear, especially after the age of 25. Skin cancer is highly treatable, especially when it's caught early. If you notice any suspicious changes in your skin, see a dermatologist or your primary care physician. Chapter 4. Breast changes. It's crucial to be familiar with your breasts and to be aware of any changes that occur. Look out for lumps, nipple discharge, or any changes in the size or shape of your breasts. Breast cancer is one of the most common cancers in women, but not all breast lumps are cancerous. Many breast lumps are benign, meaning they are not cancerous. However, any breast change should be checked by a doctor to determine the cause and rule out anything serious. Regular breast self-exams are a great way to become familiar with your breasts and notice any changes early on. Additionally, mammograms can detect cancer early, even before it can be felt.
Chapter 5. Abnormal bleeding. This can manifest in several ways, such as unexplained vaginal bleeding, especially after menopause, or blood in the stool or urine. Unexplained vaginal bleeding can be a sign of cervical cancer, uterine cancer, or other conditions affecting the reproductive system. Blood in the stool can be a sign of colon or rectal cancer, while blood in the urine can indicate bladder cancer or other urinary tract cancers. It's essential to pay attention to your body and seek medical attention if you notice any abnormal bleeding. Chapter 6. Difficulty swallowing. Persistent trouble swallowing, especially if it's accompanied by pain, choking, or a sensation that food is getting stuck in your throat, could be a sign of something more serious. This type of swallowing difficulty, known as dysphagia, can be a sign of esophageal cancer or throat cancer. These cancers can narrow the esophagus or throat, making it difficult for food to pass through. If you experience persistent difficulty swallowing, see your doctor. They can perform a physical exam and order tests to examine your esophagus and throat for any abnormalities.
Next up, let's talk about a symptom that's often associated with colds or allergies, but can sometimes signal something more serious: a persistent cough or hoarseness. A cough that lingers for more than a few weeks, especially if it's accompanied by other symptoms like coughing up blood, chest pain, or shortness of breath, could be a sign of lung cancer or throat cancer. Similarly, hoarseness that lasts for more than a few weeks and isn't related to a cold or allergies could also be a sign of throat cancer or other conditions affecting the vocal cords. If you experience a persistent cough or hoarseness, don't ignore it. See your doctor to determine the underlying cause and rule out any serious conditions. Let's move on to another digestive symptom that's often dismissed as something minor: persistent indigestion or trouble eating. Persistent indigestion that's accompanied by other symptoms like feeling full quickly after eating, nausea, vomiting, or unexplained weight loss could be a sign of stomach cancer. Stomach cancer can cause these symptoms by interfering with the stomach's ability to digest food properly and by blocking the passage of food from the stomach into the small intestine.
Next, let's talk about changes in bowel or bladder habits. Persistent changes in bowel or bladder habits, especially if they last for more than a few weeks, can be a sign of something more serious. Persistent changes in bowel habits, such as diarrhea, constipation, or a change in the size or shape of your stool, could be a sign of colon cancer. Similarly, changes in bladder habits, such as increased frequency or urgency of urination, pain or burning during urination, or blood in the urine, could be a sign of bladder cancer. It's important to pay attention to your body and seek medical attention if you notice any persistent changes in your bowel or bladder habits. Moving on, let's discuss another common symptom that can sometimes signal something more serious: persistent pain. While most pain is not caused by cancer, persistent pain that lasts for more than a few weeks and doesn't improve with rest or over-the-counter pain relievers should be evaluated by a doctor. Persistent pain can be a sign of various cancers, depending on the location and characteristics of the pain. For example, persistent pain in the bones, especially if it's worse at night or doesn't improve with rest, could be a sign of bone cancer or cancer that has spread to the bones from another site. If you're experiencing persistent pain, don't suffer in silence. See your doctor to determine the underlying cause and get the appropriate treatment.
Next up, let's discuss unexplained fevers or night sweats. Unexplained fevers, especially those that occur at night or are accompanied by other symptoms like chills, weight loss, or fatigue, could be a sign of blood cancers such as leukemia or lymphoma. These cancers can affect the body's ability to fight infection, leading to recurrent fevers. Similarly, night sweats, which are episodes of excessive sweating that occur at night, can also be a sign of blood cancers or other types of cancer. If you're experiencing unexplained fevers or night sweats, see your doctor to determine the underlying cause and rule out any serious conditions. Finally, let's talk about swollen lymph nodes. Lymph nodes are small, bean-shaped glands that are part of the lymphatic system, which helps fight infection and disease. Swollen lymph nodes are often a sign of a minor infection, like a cold or the flu. However, swollen lymph nodes that are hard, painless, and don't shrink after a few weeks, especially if they are accompanied by other symptoms like unexplained weight loss, fatigue, or night sweats, could be a sign of cancer. For example, swollen lymph nodes in the neck, armpits, or groin could be a sign of lymphoma, a cancer of the lymphatic system. If you notice any swollen lymph nodes, see your doctor to determine the underlying cause and rule out any serious conditions.
So there you have it. Those are 12 alarming cancer signs that women often ignore. Remember, your health is your most valuable asset, and early detection can make all the difference. If you're experiencing any of these symptoms, please don't hesitate to schedule an appointment with your healthcare provider. Thanks for joining me today on Zen Zone Health. Don't forget to give this video a thumbs up if you found it helpful, and subscribe to our channel for more empowering health and wellness content. Until next time, stay healthy.